sick and tired? This is the Advanced Family Chiropractic Radio Show. For the next 15 minutes, you'll learn more about the benefits of chiropractic care and how you can have an all-natural approach to your health. Be a part of today's program by calling 682-4674. And now, the Advanced Family Chiropractic Radio Show here on 1240 Radio, WOMT.
Good morning and welcome. And of course, our guest today is Dr. Josh Heimroll.
Good morning.
Back again.
Thank you.
Ready to roll.
Ready to roll.
Ready to roll. How you doing there, my
I'm doing
friend?
wonderful. Thank you.
Good.
Absolutely.
It's just a beautiful week, isn't it?
It
It's
is.
probably one of the better weeks that we've had, I think.
It's so nice out.
I'll take it.
Yeah, that's for sure.
My goodness. So today, you're going to be discussing what makes my back so tight.
What makes my back so tight?
Is your back tight or?
My back's not tight.
I was wondering.
Is
I
your
thought-
back tight?
Not right now, but
Okay.
it was a while back.
Yeah?
A while back,
Okay.
the back was tight.
A while back, the back was tight.
That's right.
Yes. What makes my back so tight? We'll talk about some of the things that you can do even at home to help with stiffness in your back. 80% of people at some point in their life will suffer from not only back pain but debilitating back pain. So it is an epidemic that needs to be taken seriously, and sometimes there's some simple solutions. So we'll talk about just your average run-of-the-mill stiffness in your back and some of the things that you can do to help loosen that up.
And a stiff back is something people probably have had since people were brought into this world, right?
Right, yeah. Sure, absolutely.
Exactly.
It's been around for a long time, and it can affect the very young and the very old.
I would imagine there's different things that different causes to tighten up one's back.
Well, yeah, absolutely. There's things. I mean, we just look at the anatomy of the back, the complexity of the back. You've got the intervertebral discs that can either become displaced, meaning bulged or herniated, or degenerative discs where the discs themselves begin to dehydrate and shrink. So you can have disc issues that can cause not only pain but stiffness. And then we look at the soft tissues, muscles, tendons, and the ligaments. You can have a sports injury. You can have an old sports injury. You can have, I went out and raked the yard too much, did too much yard work this last weekend that can cause muscle strains, sports injuries, sprains. So we look at the soft tissue aspect. We look at the vertebral disc aspect, the joint aspect itself, facet joints. So there is a whole complexity of varying issues that can cause that.
Yeah. That must a back tightness must be one of the more prevalent things that you work on with people.
Yes.
At your.
Absolutely. I think it really, patients typically don't come in until they're in the pain phase here.
Exactly.
It's usually it's like, oh, hey doc, my back is stiff, unless that patient's already been established and it's just coming in for maybe a routine maintenance adjustment. Normally patients don't present with just a stiff back. But what typically happens is unless there's some type of acute injury, that stiff back turns into pain. So it definitely behooves one to get that back loosened up before before it comes painful, or you have a greater chance of injury. And that's where a lot of injuries come from. Is that stiffness that you get in the back, and then you go out and do some yard work or lifting, and your back's already tight. You're really setting yourself up for disaster.
Yeah, you could be laid up for a long time.
Absolutely.
I just wanted to remind our listeners that if you do have a question for Dr. Heimroll, feel free to call us at 682-4674, or you can use the WOMT Shoreline text line at 920-682-4674. A really bad back can just almost cripple you until something is done to correct it, right?
So, the first kind of obvious thing that would make one's back tight or back stiff is tight muscles. Primarily, we look at stiffness in our hamstring, our posterior thigh muscles, and our glute muscles. I always tell patients, and you don't think of this, is tight hamstrings, those posterior muscles in your thighs, those all originate and insert into the pelvic area. And if you have stiffness or tightness in those hamstring muscles, it's pulling on the pelvis, which in turn is flattening the normal curvature of the lumbar spine. So having tight hamstrings is probably first and foremost the cause of a lot of people's stiffness in their back. It's not necessarily coming from their back, it's coming from tight muscles. So, just those generalized calisthenics that you learned in grade school, elementary, and junior high school, just, bending down and touching your toes to stretch out your hamstring muscles. Again, those muscles, when tight, will set you up for stiff back, and eventually, if left long enough, leading into back pain.
Someone on our WOMT Shoreline text line, and I'm not sure of this verbiage because I don't know all these different things, but it says, and it's just a statement, it says adhesion causes stiffness. Adhesion, is that correct?
So that's a good point that I was going to get into. Fibrotic adhesions. We look at what fibrotic adhesions are is basically scar tissue. And not so much in the sense when you cut yourself and you've got that superficial scar, but if you injure any soft tissue, muscles, tendons, and ligaments, primarily muscles and tendons, those you get adhesion. So it's called the fibrosis of repair. So when you injure a soft tissue, it has to heal. You tear it out, a sprain or a strain that has to heal itself. The body will heal itself. But what happens is that tissue never heals back properly. It never heals back as strong because when it heals, it heals with fibrosis. With, I guess the best way to explain that is it's a fatty infiltrate. So a good analogy would be when you're looking at a steak. And you see a steak that's all red and it's all muscle and it's pure muscle, or you see that steak that has a lot of fat in it. So a healthy muscle or tendon, a healthy muscle would look like that red steak that doesn't have any
nice and tight.
Yes, an injured tissue. We see this on MRIs. An injured tissue that from an injury that has been chronic, something that happened a long time ago, and then you have back pain for a long time. That tissue becomes infiltrated with fatty tissue, and it makes it more weak, and that weakness makes it more prone to injury. So that's why it's so important when somebody gets an injury, whether, again, it's a sprain or a strain, to whether it's your back, your hip, your shoulder, your knee, that it's healed properly. And there's a lot of things that one can do to help heal that muscle so it doesn't become full of fatty infiltrate during that fibrosis of repair process.
Yeah. And that's where you come in.
And that's where we come in.
That's right.
Yes, exactly.
That's why you're the doctor.
That's what we're here for.
And the sooner the better, right?
Yeah. Obviously, the longer the tissue is healing improperly, the more fatty infiltrate you're going to get, and the weaker the tissue is going to be, the longer it's going to take to actually reverse that process. We talked about this in great detail a number of weeks ago on how post-surgical scar tissue can become so chronic, and patients go in for whatever surgical procedure, whether it's a knee, a hip, or a back, and for whatever reason, for a reason, they still have some type of residual pain. Well, 9 times out of 10, that residual pain's due to post-surgical scar tissue due to fatty infiltrate during the fibrosis of repair process. So doing such things, treatments like dry needling, we talked about the importance of, having, if you're having any type of post-surgical issues, post-surgical pain, breaking up those adhesions from the healing process that just didn't heal quite right, and that's why you're having that post-surgical pain in many cases. That we can break that up, create a healing response, and do certain things to help heal that tissue properly.
Someone asked as far as on the text line, can chiropractor care help a person having back and leg pains due to moderate to severe stenosis of the lumbar area?
Sure. So what stenosis is there's called central canal stenosis and lateral recess stenosis. And central canal stenosis is basically where your spinal cord is housed, all right? And then the lateral recess is where the nerves of the spinal cord exit bilaterally at each level. And that's usually, stenosis is typically due to degeneration, osteoarthritis, although you can get stenosis from a tumor or a herniated disc. It's any type of narrowing of either the canal, the spinal canal, or the exiting lateral recesses. So yes, there's a lot of things that we help patients deal with stenosis. Again, whether it's the disc itself, if it's a disc displacement, bulge herniation, or degeneration. And probably the number one treatment that we utilize with patients with stenosis is the non-surgical decompression therapy, where we target that specific level that's either has that disc displacement or degenerative changes, and target that level and create a negative pressure that will either reabsorb the disc material, taking the compression off of the cord or the nerve roots, or create that decompression to open up that degenerative disc to get some new nutrients or rehydration back into the disc to help it heal properly. So absolutely.
Somebody asks, and I don't know if you have an answer to this, but they wanted to know, what can one do at home for lower back stiffness?
Okay, so to kind of get into the stiffness aspect. So the number one, the key to joint longevity in back, whether it's your back, your neck, your hip, whatever joint, is motion. The key to joint longevity, the key to joint health is motion. So if you're sitting around, you have a sedentary lifestyle, those muscles are going to tighten up. Period. So movement, getting exercise, and I'm not saying you got to go to the gym, 3 hours a day. Just even going for a 20 or 30 minute walk, every day is going to make a huge difference. Spending 3 to 5 minutes in the morning stretching your back is going to make a huge difference. I always tell patients, if everybody stretched in the morning, for 5 minutes, I would see half the people that I see.
Wow.
I mean, it really makes that big a difference. 5 minutes in the morning, stretching those like we were talking about before, those hamstring muscles. And I know myself, I've always had really tight hamstrings. I have to stretch them every morning. Otherwise, my back gets tight just like anybody else's, because I'm bending over patients all day long.
That's right. You're doing the same thing, actually.
So spending, literally spending minutes in the morning, stretching those hamstrings, reaching down, touching your toes. If you're not steady on your feet, though, you have balance issues, sit down on the floor and do it. We don't want anybody tipping over and breaking a hip.
Sit down and touch your toes or something
exactly.
like that.
Doing that both with your feet, pretty much together, and then spreading your legs, shoulder width or even further apart. Again, either standing or sitting down on the floor, doing that. Another important muscle that plays a big role in stiffness in your back, it's what's called the iliopsoas muscle, and that's one of your hip flexor muscles that brings your knee up to your chest. So stretching that muscle by putting your leg back and straighten that leg out while you're bending the other leg. So looking these up on the internet takes seconds. So stretching your hamstrings, your iliopsoas, those are really the two important muscle groups in helping patients easily. Minutes a day can decrease your stiffness in your back by 50% by just doing that.
Wow, that's great. Before we leave,
Yes.
and I think I have a topic for you for next week.
Wonderful.
Because we won't have time to get to
Okay.
it this week. Somebody wants to know how to deal with burning pain in the arms.
Okay. All right. We can talk about that. Absolutely. Always looking for topics.
All right, so you have to wait a week, but
Okay.
the doctor will
All
be
right.
back. And how do people get a hold
Yeah,
of you?
if
they need
anybody's
to?
suffering from any type of joint or muscle pain, please give us a call, either our Manitowoc or Two Rivers location, 652-0116, or look us up on the internet at manitowochealth.com.
Sounds great,
Thank you,
Doctor.
sir.
We'll catch you next week and join us then.
You've been listening to the Advanced Chiropractic Radio Show. For better health, call Advanced Family Chiropractic today and schedule an appointment, 652-0116. To download a copy of today's episode or to subscribe to our podcast, manitowochealth.com. Please tune in again Tuesday morning at 7:30 for the Advanced Family Chiropractic Radio Show.